Okay, I think it's about 2 minutes past 7 now, so hopefully most of the people that were going to join have joined now. I think we've got about just over 185 people watching tonight's webinar, which is really good. It's really good to see that there's so many people kind of tuning in to learn about things whilst on kind of lockdown. So just to introduce myself, if you want to go to the first slide, that would be really good. So my name is Mark Williams. I'm the founder of the Education Projects Group, which includes medical projects. And we've been running kind of medical work experience courses for the last 4 or 5 years. And normally during this time of the year, we would be down in London running some of our kind of work experience courses for students. But obviously this year is a little bit different with the current COVID-19 situation. So what we wanted to do was to kind of continue the learning for students and still be able to help students. So what we thought we would do was set up a webinar with a doctor who works in A&E and can provide her experience of the COVID-19 situation, give you a little bit of detail around what it is and how it works and things. And then also just kind of open up the floor to kind of help answer some of your questions as well. I know a lot of students have a lot of questions about this topic and also how it's going to affect their kind of medical school applications. So this is just a really good opportunity for you guys to do that. If we can just jump to the next slide, we'll just go through some of the information about the webinar. So this will be recorded. We will send the slides out and a copy of the recording as well in the next kind of 48 hours. So you can always watch this back later. There is a Q&A function as well, which I just want to kind of draw your attention to. It's down at the bottom. So if you have any questions, you can post them in there. And if you see that your question has already been asked, then you can use the upvote function. And it's like a voting system. So if that question has lots and lots of people wanting answers to it, it will kind of raise it to the top, and then we will be able to see that. The kind of format for the webinar will be around 20 minutes, where our doctor will be talking to you about COVID-19, and then we'll open it up to about 20 minutes worth of questions as well. So at this point, I'd like to introduce our doctor, who is Dr. Diviney. So if you'd just like to introduce yourself and just kind of tell everybody a little bit about what you do and your position in the hospital.
Yeah, so as Mark said, I'm April. I'm what's called like an SHO doctor. So it's kind of like a trust grade. I've done my 2 years of general training coming out of medical school, which is your 5 or 6 years. And I'm now 2 years above that even. So it's now 4 years out of medical school. So I've been working in A&E constantly since September, but I've been working A&E on and off for about 2 years now. So I kind of have a good view of what's normal in A&E and what's obviously abnormal in this current situation. So I work in only one particular A&E in the Northeast. So obviously everything that I talk about today is more focused on what that hospital does. There are going to be other hospitals that do things a bit differently, but I'm sure most hospitals like ours are trying to follow the guidelines from Health Education England. Okay, so yeah, as I said, you know, not every person's experience is the same. Every A&E might work a teeny bit differently. Each kind of structure is a bit differently. All the rooms work a little bit differently. And, you know, we hosted a talk a couple of weeks ago. And some, you know, guidance has changed since then. Guidance is going to change in the next couple of weeks. It's going to change, you know, next year. So what I'm kind of saying today is, you know, applicable to what's happening this week. Okay, so what I'll do is I'll just talk a little bit about what actually is coronavirus, because before all this came about, I don't know about you guys, but I didn't quite know exactly what it was, so I did a little bit of research into it myself and just thought I'd share the basics. So I'm sure you've heard it's a type of virus, very basically, but it's what's called a zoonotic virus. So it basically is originated from animals and it's kind of transformed or mutated so it can infect humans. So I'm sure you've all heard it's highly contagious, spread by droplet and human contact. And, these are a few examples that some of you might have actually heard of, obviously like the Ebola crisis itself, rabies, and the H1N1, that's our bird flu. You can tell what animal that has come from. But yeah, most people are asymptomatic. That's why all the guidance that you guys have been given at the minute is, everyone should act like they have the virus so they're not going to spread it on to anyone else. Okay, so, I'll move on to a few of the symptoms that are very general. Again, it's, most people are asymptomatic, like I've said. Then very broad symptoms, the ones I've highlighted at the top, are headache, fever, cough, things like that. Not everyone experiences it the very same way. And then what I kind of wanted to highlight at the bottom is that actually this isn't the first kind of coronavirus that the population of the world has had to deal with before. We've had one in kind of early 2000s that we've come across and got through already. It wasn't as bad as what we're dealing with now, but we've pulled through a coronavirus before. Since the last time you've done this webinar as well, I thought it'd be quite interesting to let you guys know, and if you had any questions, but I personally have had it. I've tested positive working in A&E. Unfortunately, that is a risk. We are around patients who are highly contagious with it and who are very unwell with it. My personal symptoms were a little bit of a cough, not too dramatic. I had shortness of breath for one day and I kind of quickly recovered from that. I'm normally quite a fit and well person. I had no fever, but I was very fatigued. There was, a good 5 days before I had the energy to do anything at all, really. So obviously, if you have any questions about that, can try and answer them too. So we'll move on a little bit. I'm sure you know kind of symptoms of a virus. So the interesting bit is kind of what happens when someone comes to A&E. I can talk about our A&E again specifically. So our A&E is actually now split. We've got a non-respiratory zone and a respiratory zone. So anyone who has suspected COVID and is unwell with it goes to our respiratory zone. Anyone who is also suspected COVID but kind of walking in and not too bad, they actually still go to this respiratory zone, but there's like a seated area. And then the non-respiratory zone is where our suspected infections of bacteria, strokes, heart attacks, other frail elderly patients that are coming in for other reasons, bowel obstructions, anything at all that can come to that zone. So the biggest thing that we've kind of all taken away from doing this is I've worked a fair bit in that respiratory isolation zone, and this kind of preparation and buddy up system I thought is quite interesting to let you guys kind of know about. We've all actually kind of bandied together as a team quite well in this crisis, actually. If you go in and see a patient, you bring everything that you might possibly need in, any blood tests, equipment, anything. If the nurses need you to do observations because you're already the person in the room, you just get on and do it. The same with the nursing staff, same with the healthcare assistants, everyone's just kind of bandying in together. But yeah, it's this preparation thing. So everyone just helps each other out and make sure everyone's got everything that they need in the room. Also kind of thinking about statistics and stuff that you might have heard from the government. Not everyone is swabbed for testing in A&E. If we think that you're well enough to go home, you won't be swabbed. If you are going to be unwell enough to need to stay into hospital, then you are swabbed. This is to help us know how to treat you a bit better and to help with kind of management of the patient situation. But if we think that you're well enough to go home, then it means, you kind of, it is a self-limiting illness, so you will gradually recover from it if you're normally fit and well, in theory. I know that we've had some awful scenarios of people deteriorating despite that, but most people are pulling through that. So, it's kind of what we call self-limiting. But we'll come on to kind of management and stuff of the virus. So the simple things we do in A&E: blood tests, chest x-rays, blood cultures, and we do a procalcitonin that actually looks for whether we think it's a virus or a bacteria, which is quite useful. So just thought I'd show you a little bit about chest x-rays as very typical signs of a COVID-19 looking chest x-ray. So this, I just thought I'd show you, this is not a very typical looking x-ray. This is something that looks like a bacterial pneumonia, so kind of inflammation of the alveoli at the bottom. You can see that it's all in kind of more one zone. It's all very kind of consolidated at one of the bases of the lungs. This looks like a bit more kind of this kind of stranding, if you can appreciate what I mean. There's both sides, there's little white marks that look a bit more prominent in the middle than the last one, and it's kind of all over. So this is this kind of inflammation and this gunking up of the lungs. This kind of gunking up, this inflammation, this prevents oxygen and carbon dioxide going and doing their gas exchange in the alveoli. So that causes the issues when it becomes this kind of respiratory distress. So this is an even more severe inflammation. So this is your acute respiratory syndrome. This is quite an unwell patient. This would be, you can see all the wires from the electrocardiogram. You can see that they've got some oxygen on them as well from coming down on the top. So how do you treat someone? I'm sure you kind of seen, there's a lot of things about kind of ventilation and things. There's quite a few people who don't need that. So, there's a lot of people, if they're coming into hospital, it's usually to get oxygen into them, because if they can't do the gas exchange from inflammation, they need help. They need more oxygen going into the system. So another kind of support to help this patient overcome it on their own is this non-invasive ventilation. So this is, you can see by the picture, this is our non-invasive ventilation, or NIV device. So it kind of puts a positive pressure of air and oxygen into the lungs and kind of forces it in. And that forces it hopefully past that inflammation and to promote gas exchange. And then you've got the one that's kind of highlighted a bit more in the media, which is our mechanical ventilation, which is the ITU, intensive care, where people are kind of tubed, as what people say. Okay, so there is no specific cure. Viruses are very hard. It's usually what we call supportive, and we try and aid the person to hopefully gradually get over this and help their body in as best way that we can. So yes, there's been a lot of questions about kind of PPE, which is our personal protective equipment. So I thought that I'd kind of split it a little bit. The media have kind of said, especially lately, there's been a shortage of PPE. I just wanted to let you guys have a bit more information about what PPE is and what the types of PPE that there are in this crisis. So you've got the one on the left, that's our our orange one. That's our general contact. So that's our surgical face masks, that's our plastic aprons, and that's our usually plastic or kind of latex gloves. So that's for general contact. That's if you're just speaking to someone in the same room. You obviously have to keep your distance as well. If you're taking blood tests or anything as well, on top of that, you wear kind of goggles to protect your eyes. This is for any changing people. This is kind of transporting people in the hospital as well, this is the equipment that you're wearing. The one on the right hand side, the green one, that's your PPE for this aerosol generating procedure. So anything that's going to produce more air in the room, and therefore more droplets, and therefore more contagious virus. So that's the PPE that the staff in intensive care, respiratory wards with this non-invasive ventilation, if anyone's doing like CPR, like resuscitation, that's an aerosol generating procedure, doing chest compressions and things. So you have to be wearing this full PPE. So the specific one that's been quite a shortage that's been highlighted is this, these kind of long sleeved repellent gowns. They've been on shortage. So it's not everyone in the hospital that's wearing them. It's, obviously the people that are really caring for the sick people. That's why it's been so highlighted. So yeah, so I know this is a quick run through, but I know you guys will have a lot of questions. So I thought I'd kind of run through the basics and try and answer as many questions as I can, as I'm sure there'll be lots and lots of them.
Yeah, definitely. Yeah, thank you very much for giving us an overview of that. We do want it to be as interactive as possible and to try and answer as many questions as possible. I can see that there have been quite a lot of questions coming in, so I'll just have a quick look at the Q&A. It's quite a nice one to start with. How has the mental health of people working on the front line of the hospitals been affected, do you think? Or how have you kind of found that it's affected your kind of mental health over the past few weeks and months?
Yeah, that's definitely a good question, and I think it has affected people in different ways, because everyone copes with things differently. I think in general, people started off feeling reasonably anxious and not totally sure what to expect. I think people were kind of, people in hospitals and NHS staff are resilient in nature anyway. So I think everyone just kind of was just like, yeah, let's get on with it now as well. I'm sure people were, nervous and anxious about their own health as well, because there is NHS staff with underlying health conditions. Some have had to be redeployed, some have had to totally change their work, some have had to actually isolate for the whole 12 weeks as well, just like people of the general public, which has been quite upsetting, I can imagine. I think people have tried to stay quite positive, and that's certainly come across to kind of patients and other staff members, which has been quite good. I think you just got to carry on, really. We'll come out of this eventually, and as long as people are reasonably positive, then everyone will try and get through it.
Okay, thank you. There's quite a lot of questions, or the question on top here is, I might be able to answer this one actually. What do you think will be happening to the UCAT and BMAT? I did a bit of research around this afternoon, and there is a statement on the UCAT's website actually. So if you Google COVID-19 space UCAT, you can see that they've got a statement up there. And it basically looks like they will try and run the entrance exams this year, but essentially they will delay them. So it looks like they're going to shift the start of when registrations open for these entrance exams. So nobody will be at a disadvantage. Everybody will be in exactly the same boat, but it does look like they will just shift the time when they open the registrations and when people sit them. Universities will have to take this into account as well when they're kind of looking through application processes. I don't know how each individual university is going to approach this, but all I can say is that everybody will be in exactly the same position. So don't feel like you're going to be at a disadvantage. You will probably still need to do your revision and take the test, but it will just be shifted slightly down the line. But Google COVID-19-UCAT and you'll find their latest statement on there, and just keep checking back there maybe every week to see if they put any updates about the change of dates. Okay. Here's another nice one as well. What is your opinion of the weekly round of applause for the NHS?
Definitely good. It's definitely a good thing that we're, getting appreciation 100%. And I know that some of my colleagues are actually get quite emotional about it with the weekly applause. Our hospital has kind of obviously being social distanced, we're actually spread out 2 meters from each other, but everyone tries, if they've got a free moment at 8 o'clock, everyone does come out and tries to give each other applause as well, because the NHS is employs massive numbers of people, and it's nice to give each other appreciation as well. I've been at home one Thursday night when my whole streets come out as well, and my next door neighbours know that I work in A&E, so it's nice that they kind of like turn around, they like clap towards me, which is really, really nice. I also have my cynicism about it as well, which maybe that's just me, but I always get a little bit once this is all over, will everyone remember? That's all I hope, that everyone still appreciates the NHS when this is all over, because it is such an amazing thing, and I think the UK is so lucky to have the NHS, and I just I hope everyone still carries on with that appreciation. That's all I hope, because it is amazing.
Yeah, definitely. I completely agree with that as well. I think it is an amazing that everybody in the NHS is doing, and everybody outside of, or anybody involved in kind of social care, and everybody else that worker. And it is nice to kind of show your appreciation, and I hope that it does carry on into the future and people don't forget this situation quickly. Which I think it'll be a long time before it kind of drops off people's minds anyway, because it has been such a big event. Just having a look at the questions again. The next top answer, this is quite a good one actually. Is there any possibility of virtual medical work experience? I can try and help answer that a little bit as well. So there's a couple of things that I'd probably say on this. There is a link on Brighton and Sussex Medical School. They actually have a virtual work experience kind of online course, which looks really good. So any students that are looking for a virtual type of work experience, that is one course that's available there. It's completely free as well, so I definitely check that. So that's Brighton Sussex Medical School if you Google that. Another thing that we have done actually, and this is something that we've only just put on the website today, is our digital mentorship program, where we pair students with doctors and they become a mentor for you and for your application process. So I'd go and have a look at that on our website as well. But yeah, I mean, in terms of work experience, again, everybody's going to be in the same boat, and you're probably not going to get the same access to kind of GP surgeries, care homes and hospitals for the next 6, 12, 18 months. So you are going to have to be a little bit creative with your work experience. But again, everybody is in the same boat. There are still things that you could probably do that are not kind of typical shadowing in hospital work experience. Any kind of voluntary work or any support of the local community will definitely count as work experience. So even if it's just kind of making phone calls to relatives or kind of to family friends or anybody that you know within your kind of community, just spending some time speaking to somebody that might be isolated, any kind of elderly people, like that will definitely count as experience. It's not work experience in the traditional sense, but it's what you need to show the qualities of being a good doctor.
But I think you can, like, just in an extension of that, I think you can you know, extend that and kind of reflect on, say, if you talk to someone that is, you know, isolated on your street, and if they live alone, you know, they can't get out because they're elderly and they've been told to kind of stay in the house. If you're able to even just reflect on that on some piece, or have like a little diary about what you've been able to do for them and how they've responded to that, and their body language and your body language, you know, maybe it's just on the phone or something, and the appreciation that they might have, you know, that shows that kind of empathy that you need and can kind of show universities that you've got.
Yeah, definitely. There's one of our kind of ultimate guides. If you look in the application guide section on the website, there's an article on there that talks about reflection. So anything that you do now or have done in the past, whether you need to use as work experience or as part of your application process, you need to learn how to reflect on it correctly and do that really, really well. But that article on the website will actually help you with that. So go and check that out, definitely. Okay, the second one again there was about work experience, so we've kind of hopefully covered that one.
Yeah, I suppose we tried to extend that answer really, because there's been a lot of questions, understandably, about trying to gain work experience on this. There is schemes and stuff, but obviously everyone's trying to help at the minute, so the volunteer schemes are even full. I know they've put a full pause on that NHS scheme for the good couple of weeks. You know, if it, keep checking, and if it reopens, that'd be great. But there's actually local schemes as well that people are getting in via Facebook, that they are kind of arranging as a community. So if you can get involved in that and say that you've been within this community group, take a bit more of a responsibility in that fully will count. And if you can write and reflect about that situation, then that will count 100%. And if you're able to use a scenario like that for your university application, it'll actually look quite good.
Yeah, definitely. Let's just have a look down. I'll try and find some questions like closer to the middle and the bottom, so everybody kind of has a chance of almost getting a question answered. This is quite a nice question. What is the most rewarding part of your job? Whether that's now or whether it's outside of COVID, I don't know. Maybe both.
Yeah, I suppose it's probably both. I kind of got into my job and love my job because it's kind of sounds a little bit cliche, but it's helping people. But it is, though, because if you've got this like 92-year-old lady who comes in and she's frightened, she's got dementia, and if you're able to just spend that extra 5 minutes with her and able to kind of talk her down, talk to her about what's going on, and if she can't kind of have that conversation, at least you talking away to her gives her that, you know, relief. You know, these people coming into hospitals are so vulnerable that if you can just make them feel a little bit better, you know, along with the knowledge and along with the science and along with the clinical skills, if you can just make that one person feel a little bit better for the day, you know, that makes my job feel wonderful when I come home. And if I know I've done a good job that day and I've been able to, you know, do that one thing for someone, then, you know, I look back on my day and I think, yeah, I made a little bit of a difference, just even to that one person. It matters.
That's good. Excellent answer, thank you. Let's just have a look down here as well. How do you think the NHS will change after this pandemic?
Yeah, I think that's definitely an interesting question, because I think we should look at whether things should change, which even before all of this, I'm sure everyone will have heard at some point on the media, the voting and the government and stuff like that, you know, the NHS itself is very stretched. It's been interesting these last couple of weeks to see how different A&E life is. I can say from my A&E, it's been a bit strange to kind of see that it's actually, you know, we've kind of all felt a little bit guilty that it's not been as busy as has been made out in my region anyway. I can't say that for other regions and other hospitals. So it would be interesting to see how the NHS can change, because I think it could. But I think it takes something dramatic to change it. Like this. But it's whether people just want to go back to a bit of normality after this. So whether things actually might not change. I know this is a really backwards answer. I think ultimately it won't, but I think it should, if that makes sense.
Yeah, I think there's, everybody always has their own kind of opinion about how the NHS could be changed or could be changed for the better.
Yeah.
And you always think that it takes something dramatic or something huge to change it, and hopefully this will show people the importance of the NHS, because, you know, maybe 6 months ago it was being spoken about quite a lot in politics about being privatised in certain areas and little bits like that. I think this might just kind of strengthen everybody's opinion and love of the NHS, and it might just kind of completely squash any of that kind of privatisation talk for a while, which is great, because we definitely don't want it being privatised at all.
Yeah, I think what my hope is, like my personal hope, is that even though things will probably go back to normal at some point, obviously no one knows exactly when that's going to be, that maybe looking back on this, you know, this period of time, that maybe we could say, actually, that kind of worked a little bit, having that in that place, because we've had to kind of restructure the hospital in a way. So kind of surgical reviews are happening in another hospital. You know, obstetrics and gynecology is staying at our hospital. You know, things have changed a lot with management wise. So whether that changes gradually and they think, right, that didn't work, but that did, maybe that might happen. That's what I kind of hope.
So we've got a question here from Hannah, and it says, what is the biggest thing you would like the public to know during this outbreak?
One thing has come to my mind like straight away, and again, maybe I'm just a little bit cynical, but it really annoys me when I see people walking around with face masks and gloves and they're not using them properly. I think that's what I want people to know, that if you put a face mask on, you touch your face, touch some food in the supermarket, and then touch your face again. That's not how they work. I think maybe that's just me giggling away, but I think that would be great for people should know. But yeah, I think the other side of it is that you know, it's not all as negative as the media are portraying. I think that's my other side of it, is that there is a lot of positivity coming out of this. Yes, there is unfortunate, like really awful cases where people have died, and that is really awful. But there is people that are recovering from this. There's a lot of positivity, and you know, we will actually come out of this, you know, eventually, and you know, we'll look back on it and just be like, oh gosh, can you remember that time? So yeah, they're probably the two main things. I know you said one, but
okay, yeah, I think I've spoken to quite a lot of doctors in the last week or two, and the numbers that you see on the news have been terrible. But I think there's been a general consensus that it's been managed relatively well, or the amount, or hospitals have managed to cope much better than maybe expected. I think the staffing within the hospitals has been really good. And I think the number of people in the majority of hospitals hasn't been as high as necessarily expected. And that's something that I've heard from quite a lot of doctors. Has it been similar in your hospital?
Yeah, it's been like you said about the staffing. I think my particular hospital, I think they've tried to make sure that there's been like more cover than needed. So we had like one day where we had like 8 junior doctors arriving in A&E at 4 o'clock for a shift when normally there might only be 4. So they have tried to stay on top of it because, you know, as I said before, staff have got sick and staff need time off. So I think they've obviously, managements have kind of thought that already and forethought that. And I think the UK, even though like you said, the numbers that they still have been very high, I think it could have been a lot worse.
Okay, I'm just having a look at I'm just going back up to the top to see if there's been any more upvotes. So this isn't necessarily linked to COVID-19, but it is a question that a lot of students like to ask doctors, and it's how did you know medicine was right for you?
Yeah, that's I think that's a difficult question for me, because I think I was one of those people who, from when I was 5 years old, I had a stethoscope when in my toy set, you know, and my parents had always said I wanted to be a doctor. I think I just had it in my mind that that's what I was going for. And the more people that I talk to, like careers advisors, other teachers, relatives, friends, anything like that, I kind of knew that my personality and my kind of knowledge and skill set was very suited to that as a job. So I knew that from my work experience and things, that it'd be a job that I'd enjoy. So I think I had the idea initially as a kind of like a vocation and career for me. And then as soon as I started talking to people, getting more experience, seeing the job for what it is, I knew that it was, you know, something that I definitely had to pursue and something that I knew I'd enjoy as a job.
Okay, I think I'll flip the question around then. If you knew from quite a young age that it was something that you wanted to do, was there any point where you thought that you didn't want to do that? Or was there any times where you doubted that you would be a doctor?
Yeah, I think that's quite a good question, because there was probably a lot of times that I doubted whether I could actually even get in. So I had, you know, reasonably good predicted grades. I'd quite a lot of work experience, but my kind of my downfall, I think, was that I didn't kind of reflect on what I'd learned on that work experience and learned in my years in secondary school. I actually didn't get into medical school the first time round. So I actually took a gap year and basically got more work experience, actually reflected and did my work experience properly the second time round and got in the second time round. You know, I'd considered lots of other jobs between those couple of years, whether teaching, whether going into more lab-based work was for me. I think I knew that I wouldn't be happy in those jobs for me, so I kind of persevered and made sure I applied the second time round.
Okay. So there's a question here. Do you feel any particular socioeconomic groups are being diagnosed with coronavirus, e.g. the homeless? I think that question is asking, is it affecting one socioeconomic group more than others, or are you seeing kind of just a general, it's equal amongst everybody?
From what I'm seeing, it seems to be reasonably equal. I don't know whether that's the general the broad-based population in the Northeast, or whether just that's the type of people that access, and whether not as many homeless in my region access it as much. I actually haven't seen as many homeless as we actually normally do during this crisis, which take that how you will really. There's lots of kind of thoughts about it, whether they are just staying away fully, whether they feel that they can't come to hospital, whether they usually come with other issues and they're staying away for the virus reasons. It's hard to know really. Obviously, I can only say from a hospital point of view. I'm not sure from a community point of view and a paramedic point of view what sorts of cases they're seeing. But it seems to be kind of, more generalized split. But again, that could just be the kind of more population of the region that I'm in.
And then typical age groups, are you seeing that there's more people coming into A&E that are kind of 40 plus or 50 plus, or again, are you seeing a lot of kind of younger people as well?
I'm seeing a range, if I'm honest. I've seen people in their 20s. I've seen a 16-year-old, two 16-year-olds actually. They haven't been too unwell with it, and I've sent, I think, everyone that I've seen below 40 have been well enough to be able to go home. I think there's been a few cases of people above 40 that I've seen that have been very, very unwell. But I don't think I've seen, personally, I don't think I've seen many too unwell under 40-year-olds.
Okay, it's about 45 minutes into this now, so I'll try and find a couple more questions. Mm-hmm. So I'll just try and scroll down to see if I can find some that are slightly further down to give everybody a chance.
Yeah. Obviously still quite a few people listening, so that's good.
Yeah, definitely. So we started on about 180 and now it's at 220.
So get your questions in, guys. Like, I don't mind staying for another 10-15 minutes if you still want to hang around.
Yeah. Okay.
Yeah.
So this is about kind of breaking bad news. Mm-hmm. Have you kind of had to break any bad news that's been around the COVID, or has been COVID caused recently, or during the last kind of weeks and months?
It's been quite strange, actually. It's not so much, the shift hasn't been so much the breaking bad news side of things, because I've had the fortune of not having a case that has deteriorated very quickly in A&E. I've seen a few people who unfortunately have died, but once they got to intensive care. So it's the shift has actually changed to discussing patient wishes and patient suitability, if that makes sense, towards ventilation, like mechanical ventilation and resuscitation. So there's, to kind of let you guys as students know, I presume majority are students, but the way that we view resuscitation as healthcare professionals is that if you have someone in front of you who has a lot of what we call like comorbidities, which are they might have been diagnosed with certain diseases. So say, for example, you have someone who's in their 80s who has had a previous stroke, a previous heart attack, has lung disease, vascular disease, and might have dementia as well. They're very awful things to be suffering with. And all of those things make it more likely that you won't come out of it like a cardiac arrest. So it means that if your heart was to stop, though the best healthcare we can give you and resuscitation we could give you, it's unlikely that you're going to come out of that. And if we did, you'd be in what's called this kind of like vegetative state, which on the whole, a lot of people don't want to take that risk. there's a lot of people who would be in that scenario, which I've come across. If they have all these comorbidities, most people are just saying, you know, I've lived my life. I don't want to take that risk. I don't want to suffer any more than I have to. So that's when we think about resuscitation orders and things, but it's quite a difficult conversation to have. So you kind of end up approaching it like this Breaking Bad news scenario. You kind of have to be very delicate about it, because some people have a preconceived notion about resuscitation and not resuscitating someone. Some kind of some people of the general public sometimes think that it's us giving up on them, which it's not. It's just being honest that if their heart was to stop, then they're unlikely to come out of that situation. So I've had a lot of those discussions throughout this crisis, because I think with the way that the body suffers with COVID, you go into this acute respiratory distress, and if you need ventilation and mechanical ventilation, if you are someone who has a lot of comorbidities and are elderly and frail, you're not likely to come out of that. So you're needing to have those discussions early in A&E to kind of say, you know, we may not be able to look at this management option for you. So, you know, that's quite a difficult conversation that we've had to have.
Okay, thank you. So this is a question more about kind of your work-life balance from Molly. How do you maintain a good work-life balance?
I suppose I presume that this is kind of in general, as you know, as a doctor.
Or has it been affected by this?
Well, I suppose it has, because we can't leave our house otherwise, really. So I'll say in general, and I'll just say if it's changed much with this crisis happening. So I have a reasonable work-life balance, actually. I think in the last few years to, in the last couple of decades, doctors have been viewed differently, and I think they've been very open with their view on work life as well, that there's a lot of people that, it is a job at the end of the day. Yes, it's an incredible job, but I think for your own mental health and your own sanity, you kind of do need to have that extra life outside, whether it's sport, whether it's music, whether it's family, friends, just going to the pub or something. You do need that time. So the job has changed a little with regards to kind of rotas and how many hours you're in per week and things. So that has changed, and that's changed for the better, I think. So I've still been able to see my friends, get the train to see them. They live in other cities because we all went to medical school together, but we don't all live in the same city now. So that's been nice to be able to see them. It obviously has changed, like for everyone, during this crisis. I've obviously not been able to see my friends. I've not seen my family since February, I think, which has been quite sad, because obviously, if I'm seeing all these patients in A&E, I don't really want to pass on any what might be on my clothes and things like that as well. And as I said, I was unwell for like 7 days myself, so wasn't able to see anyone and leave the house at all. So that did change a little bit, but still able to do quizzes and bingo and things like that as well. So that's been good, and I'm talking to some of my family members more than I would anyway. So that's been nice.
There's still a lot of questions, work experience, and there's kind of lots with about kind of 25 upvotes each. So I think what we'll do, we might either do a separate webinar just looking at volunteering and work experience and how to reflect in the next together to go through that, because it's obviously something that we can try and help with. It's something that we do on our courses anyway. So we'll definitely do some. So check your emails over the next kind of week or two, and we'll either post something out as a blog article, or we'll do another webinar based around that as well.
Yeah,
I just want to say as well on that. Yeah, go on. What were you going to say? Sorry.
I was just going to say that I think that that's a huge conversation, especially out, that's not just kind of a 5-minute answer. There's lots of options and lots of discussions on how to take work experience, especially with all of this. So yeah, I think, something bigger would be quite interesting. I'm sure the students would agree with that.
Yeah, definitely. I was just going to say on the last slide as well, there is our kind of social media links. So if you want to drop us a message about what topics you'd like to do or what topics you'd like us to cover in the next webinars, either send us an email or find us on the social media and let us know what topics you want to cover. There's only so much we can cover in an hour, but we can definitely do more webinars if that's what everybody wants. So just let us know what you want to cover. I'll try and find one final question. Let's try and make it a good one.
Yeah, make it a good one.
Yeah, there's so many about work experience. I'm just trying to get past all of you. We'll definitely do another one on that. Is there any kind of like final words that or any final thoughts around this kind of COVID situation that you'd kind of like to share with the students, or how you've at least seen it change over the last kind of 4, 6, 8 weeks?
Yeah, I think it has, it definitely, for me, it seems to be easing a little. So I suppose that's I suppose an element of positivity kind of to end on. It seems to be that though there's kind of COVID cases still coming in, I think that's going to be the case for the next couple of months, which A&E is kind of usually the first to see things start and usually the last things, because obviously there's going to be lots of people who are still coming in with symptoms and are going to present to A&E in the next few months, but should be well enough to kind of go home and things, so we should be able to ease that burden a little bit on the kind of back of house hospital section. Yeah, it seems to be easing. I think it's still going to be a while before things even remotely go back to normal, which is probably not what you guys want to hear. Because I think the key is that they're already highlighting this on the government kind of daily briefings as this kind of second wave, that, as soon as we lift anything, I'm sure you guys are a little bit fed up, just like I am, that you're not seeing people. So people probably are going to go a little bit mental with trying to socialize. So things are going to have to be kind of released gradually, if that makes sense. But I definitely think there is positivity coming out of this. There's a lot of things that you might have seen that a lot of kind of zoo animals are kind of making babies for the first time in years and years, the pandas, and then there's less and less global kind of emissions coming out of this. There's a lot more kind of animals being seen and fish in the sea, which has been great. And I hope that kind of we all can take a little bit away from this and think, oh, how can we actually change as for the better and kind of keep our planet going. And yeah, I think that's the kind of kind of an end message really for me, but if you have anything else that you wanted to ask.
I don't think so. I think there's a lot in there about work experience, but like I said, we'll do a separate one on that. Yeah, thank you very much for taking the time out of your evening to kind of talk to us and the students. We really appreciate it, and really appreciate the work that you do in the hospitals as well. So thank you very much for joining us, and hopefully we'll get you back on another webinar soon.
Yeah, absolutely. You know, I'm more than happy, because I know it's so confusing and strange and like odd all this time is, and you know, any kind of advice that you can get, like, don't take your advice from Facebook or Instagram. You know, take your advice from the daily briefings. They're actually been quite good. They do get a little bit repetitive, but they've been good about having the medical officers there as well. Don't listen to all the reporters. They're asking really odd questions. Just listen to the actual facts. And, you know, there's getting more research out there online, and you can get more kind of valid information. So I'd say go to those sources for your information, rather than like the general media.
Okay, good points. Thank you very much. Right, okay, so that's been just about an hour actually, so thank you very much for kind of watching the webinar. We really appreciate it. We will send the slides and a copy of this out within the next kind of couple of days, so look out for that. We'll also send you an email about any upcoming webinars that we're going to do as well. So thank you very much, and hopefully we will see you again soon. Thank you very much.